what appointments meeting those criteria are available. So I'm going to go ahead and I'm going to schedule this patient in here for this Friday. I'll go ahead and highlight that, book the appointment. And now this is another nice feature of the system. Based on the visit type, you can set up questionnaires where you want to attach certain information to the appointment. So in this particular case, I'm pretending that for initial office visit, these are the questions that we want to ask. Now, if a certain question is required, it actually won't let you leave the screen unless you put in that required piece of information. So in this particular case, I'm pretending that the referring doctor needs to be captured, and we can capture that just through a lookup table. Other things can be put in through drop downs, through help text, etc. And then we put that information in. Etc., etc. And then this instructions down here is to remind the scheduler what to say to the patient about the appointment. So in this case, for initial office visit, we want the scheduler to tell the patient to arrive 15 minutes before the scheduled time and fill out any necessary paperwork. So I've now scheduled that appointment. And there the patient is in the system at 1 o'clock, right where we scheduled her, right? Pretty easy. Okay, let's move on. I've made the appointment, and now I'm pretending that the patient has arrived. We're at the day when the patient walks into the clinic. Obviously, the appointments can be made either within or outside the clinic. And by the way, with our patient access portal, you even have the ability to have patients being able to make appointments over the internet. Now, I will tell you that you get to control, you, the practice, get to control any or all of the features and functions in the patient access portal. Maybe you might want to only let patients make return visit appointments, or if you're a OB/GYN, maybe OB rechecks, etc., and not GYN appointments. All of that is completely controllable by you. Now that we're in the office here, changing our seats, and now we're sitting here and we're at the front desk registration. When a patient comes into the office, let's say Helen Anderson actually arrives, I can right-click on their name, and I can click the fact that they've arrived. This is a flag we have set to, again, bring up the patient information when they arrive in case there's a change in address. You may want to print something out, just verify certain information about the patient. By the way, you also notice that we also show their insurance coverage on this screen along with their copay information. This is available whenever this information comes up. And the point being is when they've arrived, what we've done is we've time-stamped that, and I'm going to also mark that they've registered, and we also change the colors. So as these patients arrive or are registered in the practice, all this gets time-stamped, and the colors changed. Okay, you with me? This is very useful. These timestamps are very useful because you can obviously see your patient flow within the clinic, when patients are arriving, when they're registered, admitted, etc. But we also have reports. So if you are dealing with any workflow issues, you can see how long patients are waiting and how long you're spending with them. Very valuable reports. So now that this patient has arrived, I'm going to switch chairs again, and I'm going to pretend that I'm the physician. And the physician is sitting here on the electronic health record with his particular view of the world. And this is we call this the doctor's homepage. I'm now the provider, and I'm looking at my schedule through the view of the electronic health records. As you can see, it's a totally integrated system. The same colors that are appearing on the appointment schedule on the screens I was just looking at are being changed and shown on the doctor's homepage. So as the doctor here, I can see that everybody in orange, for example, are waiting in the waiting room and are ready to be seen. So if I'm back working in the clinic and I see 8 people in orange, I know that I'm pretty backed up. If I only see one person in orange or nobody in orange, then I know that I have some time here that I can do other things like sign off on notes or make calls or whatever you might want to do depending on your workflow. While I'm talking about the doctor's homepage, I want to indicate there are actually 3 sections to the doctor's homepage, and I'm going to bring up what we call the split mode so we can see all 3 sections at once. Section 1, as I alluded to, is the appointments that I can see, and I can go and look at any particular day. Section number 2 is review items. Review items will be anything that needs to be signed off on. If you're on a paper EMR system, which you probably are now, I would basically compare these to the charts that stack up on your desk throughout the day, and you need to sign off on things. These could be dictations that need to be signed off on, notes, etc., or they could be, in this case, I'm actually looking at lab results here. By the way, I can go ahead and make this review items bigger so I can look at only my review items. Okay, so I'll get back to Health Watcher in a minute. So these are actually review items, and you might ask, well, why are some of these items in red? That's where we have a flag that will automatically tell us if we have any abnormal lab results to go ahead and show that in red to alert us that we may need to look at these more quickly than the others that came in that were normal. Okay, back to the split mode. The third area in our split mode is our messaging. This is a workflow feature of the system where the providers can both send and receive messages to other members of their staff, support staff, and with if you're using our patient access portal, you can actually send and receive messages directly to patients, to the patient access portal. By the way, our patient access portal is a completely secure, HIPAA-compliant portal. It is not the public internet. The public internet is not secure, so you cannot send lab results, for example, to the public internet. But if you're utilizing the patient access portal, you can go ahead and send lab results and other medical information because it is completely secure and is not open for the public to hack into. I'm going to basically just take you through a kind of a little workflow scenario about seeing the patient. I'll pretend that I'm the doctor. I'm looking at my schedule. And again, I don't know how it works in your practice, but I'm going to go ahead and send a piece of a message about this patient, about this appointment. I'm going to send a message, and I'm going to route this message to my front desk staff. The system knows who works at my front desk, and I'm going to send a message that will say something like, bring the patient to the room, I'm ready. By the way, while you're typing, we have a feature in the system called acronyms. You get to create your own acronyms. It's very easy to create your own acronyms. So let's say there's some sentence or word or phrase I use all the time. Rather than typing it out, I can just use a few characters. So in my particular example here, if I type in ABN and expand it, it can expand to abnormal. An acronym can expand to just a word. It can expand to a phrase. It can expand to a whole paragraph. Okay, so this is a tool that we have in the system, obviously, to keep the typing down to a minimum and make you more efficient. Now, this particular message I'm going to send as a shared action item, because in this particular example, I'm going to send this to each one of these people, all of which work at the front desk. But the first person to complete that message, I would have them actually, when they complete it, it will go away from the other people's inboxes. Individual action item would be I want everybody to respond, so it would stay in everybody's inboxes till they individually completed it. So I'm going to go ahead and send this message. And by the way, I'm sending it to myself as well, just so I don't have to log in and log out to see for that message, for you to see the message come in. And if I go to my